All right, happy Tuesday, everybody. So today we are going to have a nice discussion. Let me go ahead and just kind of get myself situated. I'm going to close that. So my name is Snizhana Weber. I'm an exercise physiologist for outpatient cardiac and pulmonary rehabilitation. And my job is help patients to return to their everyday activity. So we see patients here in North Kansas City Hospital Monday through Friday. And so as an exercise physiologist, I do a lot of education on wellness, movement. We do a lot of education on breath work and meditation, and we have a dietitian who comes. And one of the topics we actually talk about is resuming sexual activity, safe sexual activity after cardiac event. So today what we're going to do, we're going to discuss what challenges patients we face in our society, and how can we address that. And we will talk about really practical tips and practical recommendations. What can we do to actually be safe, feel good, and have a good quality life despite any type of challenges, health challenges that we might face. So let me make sure that it's moving. Okay, so I have no conflicts of interest, so I'm not going to discuss any prescription medications or any FDA approved or non-approved medications. Just want to mention that. And I would like actually to start with a misconception on aging and sexuality. So when we think about what we think or see us aging and think about what is attractive, what is sexy, when is appropriate age to stop having sex or start having sex. I think that society has all those regulations and rules for us that some of us believe it might be true. So today I just kind of want to touch on that and kind of challenge you personally to think about what misconception you have about your personal aging body, because we all age eventually. And what do you think about your own sexuality? What do you think about intimacy and sexuality? Do you think is the same or it may be different? So when I see my patients and when we talk about this topic, so a lot of people kind of see themselves not as sexy anymore. They're not attractive anymore. So maybe as we, facing health issues, we feel like we shouldn't have sex anymore. We're too frail to engage in sexual activity. I am too sick. I don't feel like doing that. And maybe sex not as important for us as we're getting older. So I always kind of look at, sexuality and, intimacy as a personal choice. What do you really think about yourself? What do you really think is appropriate for you? And in society, especially in the United States, we feel like if you are not, younger 40 and look specific way, that we kind of not relevant anymore. So I just kind of want to challenge you on that and really think about what is, what is really you're thinking, what is good for us or not so much. So let's talk about, what, my PowerPoint is stuck. So let me see if I can. Oh, okay, here we go. So we're moving along. So there's a lot of kind of technical issues. It's not my office, not my computer, just trying to figure out my way around. So sexuality and sexual activity are markers for well-being. So I just want to touch on intimacy. And a lot of people, I think, I personally kind of used to be confused about, what it means to be, sexually close to somebody, or what actually intimacy is. And sexuality is feeling, right? It's feeling, it's desire. It's actually can be supported with action. It's our identity. It's our identity. And intimacy is a feeling to be close to somebody, to have connection with your loved ones in relationship that can occur with or without any physical component. So I just want to touch on that, so that we really, when we talk about resuming sexual activity or talk about sex or intimacy, that it's not necessarily, what it means is having sex. So sexual activity or intimacy is not harmful to your lungs and your heart. And resuming intimacy and be close with your partner actually makes us happy. And sometimes we probably forget that because we get so occupied with our personal stuff that we forget that, hey, actually isolation and not having somebody in our life is making us really lonely. So that's, I want to kind of touch on that concept. So why do we even have, I mean, as an exercise physiologist, I'm not a physician, so I, maybe some people feel like it's maybe not my place to discuss this sensitive topic, because it is a sensitive topic and there's a lot to talk about, regardless sexuality and resuming safe sexual activity after cardiac event or any type of illness. So, but reality is, when we look at statistic, that we know that our doctors, our cardiologists, our physicians really don't have as much time to spend with us. And reality is, we don't have time to talk about personal, aspect of our life. I always feel like when I see my doctor, they really don't ask me, am I stressed? How's my sex life? How am I doing? How am I sleeping? So usually on our wellness exam, we just cover, exercise and diet and just kind of all those general topics, and we really don't talk much about personal things that actually, makes us human. So again, when we look at statistics, physicians don't have as much time, and when you come to your doctor, you have, they say it's 17 to 24 minutes, but I feel like it may be just even less than that. And half of that, it can be you discussing your new medications and other things, blood pressure and things like that, that you really don't have time to talk about personal stuff. 40% of men and less than 20% of women talk about sex with their physicians. So we really don't, our doctors do not start that conversation. And I think that we as people, patients really want a doctor to ask. They don't want to maybe start this conversation. They don't feel comfortable, talking about that. That's something that I feel like we, as healthcare providers, want to really keep in mind, that start the conversation, see what is a comfortable topic for you guys, and really talk about it. And obviously we know that when you look at gender, so doctors less likely to discuss sex with women patients than men. So what I would advise, if it's this topic really important to you, or you seen your physician, you really did not touch on that subject, it's always great to go with your spouse to doctor appointment, and two of you talk about it and say, hey, we do have, kind of a couple personal questions, and can we kind of unpack this topic and talk about it? Because I think if it's as a couple, you have this discussion with your doctor, they're more likely to spend extra time and actually look the matter of fact and see what is going on, and if there's any issues or problems, we can address it. Okay. So now I want to talk about more practical stuff. So like I said in the beginning, so my job as an exercise physiologist, all I do all day long is looking at heart rate and blood pressure and oxygen, and we're looking at all those physiological response on physical activity. So we do forget that sexual activity is a form of physical exercise. So it is an exercise. So if you worry, like, I don't know, is my heart rate will go up? Am I going to have another heart attack? Is it damaging for me? What is happening to me physiologically? Reality is that during sexual activity, your heart rate will increase, your blood pressure and blood flow will increase as well, and you will have increase in oxygen consumption. So basically means that your oxygen might drop a little bit, because you're going to consume more oxygen. So when you look at cardiovascular effect and effect on your heart rate rarely goes above 130 beats a minute, which is a very safe heart rate. If you are taking some type of beta blockers or blood pressure medications, it might keep your heart rate about 100 or less. So your heart rate is not going to go in a dangerous high zone. Okay. Your blood pressure does not exceed over 170 diastolic. So again, you're not going to have, dangerous, extremely high blood pressure as well. So the question is sex an exercise? Yes, it is, for short duration. So we are not engaging, we're not talking about, hours of sexual activity when your, heart rate is too high, your blood pressure is too high. And again, when you think about your, even blood pressure specifically, because a lot of people really pay attention to that. So your blood pressure will go up at peak. So, right, it's not going to stay there for, for a long period of time. So again, just kind of look at that and say, okay, so now I know what's happening to me physiologically. So when we look, so how does that compare to physical activity? So metabolic demand for sexual activity is modest. So range of 3 to 4 METs. So I'm going to explain to you guys what METs. So METs is it's kind of a measure of how much energy or oxygen we as human consume. So for somebody to put a clothes on is about 1 MET, brushing your teeth, doing more challenging activity is going to increase your METs. So regular people, just like us, age 50 to 80 plus years old, so it's basically everybody older than 50, their METs or their energy should be about 3 to 4 METs on daily basis. So it's not something that is impossible to achieve physically, right? So example would be climbing 2 flights of stairs, pacing yourself, walking briskly. I always tell patients, what does it mean walking briskly? Just walk a little bit faster than your normal walking speed. If you're late somewhere, how fast would you walk? So that kind of, you will test on that. That's walking briskly. New Step, it's a specific bike that we use at our facility, but I know that YMCA does have it as well. So New Step level 2, about 80 to 100 steps a minute, is also not much exertion. Bicycle, light effort, and any general housework that most of us do weekly, and light outside work as well. So again, when you're looking at, maybe talking to your spouse or thinking about your own health, so all those things would indicate if you can do those things with, some exertion, moderate exertion, perfectly safe. So this is something that you want just kind of look at and test yourself on that, okay? So now I would like to talk about, I'm not going to touch every single cardiovascular condition, cardiovascular event that people have, but I will touch on the most common and kind of give you little guidelines. But I would still obviously advise you to have this conversation with your physician, or maybe if you don't see a doctor, maybe a cardiologist, nurse, and kind of to make sure that you follow instruction of your physician. So if somebody had a heart attack, and maybe you had stent, so recommendation for resuming sexual activity will be about 1 to 6 weeks. Okay, 1 to 6 weeks. It depends what type of maybe new medications you're taking, how are you feeling physically and emotionally. But again, about a week up to 6 weeks is perfectly safe. Something more severe, like open heart surgery. So we wait about 10 to 12 weeks. So it's not just resuming sexual activity 10 to 12 weeks. It's doing any type of activity, like you can walk, obviously, but any type of, pushing activities, vacuuming, raising your hands and things like that. We want to avoid it 10 to 12 weeks. So this is just kind of a recommendation for everybody. And slowly, about 10 to 12 weeks, is everything looks awesome, which is everything is going to look good. We will start slowly adding on some type of things, using your upper body more, and you're going to be comfortable to going back to your everyday life. Heart failure, it's another one that challenging for people, and a lot of people probably think, oh my gosh, I have a heart failure, I can't even walk, and you're talking about resuming sexual activity. That can be very dangerous for me. But like I said in the beginning, so we want to really look at misconception, we really want to look at intimacy, and it does not have to equal sex only, but reconnecting with your partner is very, very important. So really not just concentrating on challenging things physical things in our life, but really looking at how can we, reconnect with our loved one so that we can actually feel better. And I put that cardiac rehabilitation and regular exercise can be useful to reduce the risk of cardiovascular complication with sexual activity. So obviously, some people who listen to me today, like, well, I don't go to cardiac rehabilitation. What do I do? YMCA, so if you participating in any type of physical activity, YMCA gym fitness center, so that's basically all means the same. Cardiac rehabilitation is just more supervised exercise program, okay? So, but if you are physically active, you're more likely to go back to your everyday life and actually do better. If you were not active before your cardiac event, so that will obviously take a little bit more time and dedication and commitment and establish that habit so that you're becoming physically active and you feel comfortable and safe to go back and doing your everyday activity. Not just, having sex, but just even make it easier for yourself to, clean your house and, enjoying things that you enjoy. So, like I said at the beginning, we are going to talk about practical things, what actually does affect male and female hormones and sex drive and just our energy level, right? It has to do with energy as well. So everything I say, it's not necessarily it's going to help you, to go back to your, intimacy. It actually is going to help you feel better in your everyday life. And when you are feeling better, everything does, makes it a little bit easier to do, and you enjoy your life so much better. So what can affect our sex drive and our energy? So people who have a low calorie intake and people who have high calorie intake that we need, right? So we don't want to look just at our nutrition as, is it good for me or is it bad for me? Can I have bacon or can I have eggs? What am I eating? Can I have red meat? So we don't want just kind of single out. We want to look at, nutrients and vitamins and minerals and all those things and just say, hey, am I eating clean diet? Am I having some good protein? Am I having some veggies so that you have a good quality food that actually can support your body and give you energy and you can enjoy doing all those things? Another common mistake that I see with my patients is a low fat intake. A lot of people after cardiac event, they scared of the fat. We actually just this morning had dietitian have this discussion. A lot of people stop eating good quality butter and they just don't consume any fat at all. And actually fat needed in our body. So healthy omega-3 decreases inflammation, and that's what you need. So it helps with your cardiovascular health and helps you with your energy and gives you energy. It makes food taste so much better. So just kind of really looking at that and revisiting and say, hey, how is my diet? It can be the problem that I may be, eating too much or not enough or not eating a good quality of meal, with all those nutrients, and kind of looking at food as bad or good, which is, I don't want you to do that. I just want to look at like as good quality clean food. Depression, stress, and anxiety is a big challenge for a lot of people. We do face it after any, chronic illness and cardiovascular event as well. And when you think about relationship and intimacy, I see that psychosocial aspect is the biggest problem, because when you don't feel like yourself, you limit your sexual activity, you don't connect with people on a deeper level as you used to, and maybe you don't eat as well, or under eating or overeating, things like that. So this is something to look at and really get some help and talk honestly to people, reach out and see what is available to you. How can we help you? Aging, obviously aging does affect our hormones, our testosterone, and for women, estrogen and progesterone, and sleep. So a lot of people don't realize that poor, minimal sleep is going to affect you as well. And when I said obstructive sleep apnea, including obstructive sleep apnea, what I meant is untreated obstructive sleep apnea. So if you are using CPAP or BiPAP, or maybe some people use oxygen, so you are safe. So you have treatment for your obstructive sleep apnea. But if you have undiagnosed obstructive sleep apnea and you're undersleeping, something to look at. And when we say poor or minimal sleep, so you're just kind of looking at your hours, sleeping hours. What time do you go to bed? What time do you wake up? A couple of things I would like to mention on hormonal level. All your hormones and cell level actually restore during sleep. So if you are not sleeping good, sleeping less than 5 hours at night, your body has no chance to recover. Your body has no chance to get that testosterone up or this estrogen going and actually feel any type of desire to do anything. So for males, actually, your testosterone will restore every 24 hours. And for females, it's every 28 days. So we even on, gender level, we have a very different hormonal needs, right? So, but despite that, we really need to know that sleep is very, very crucial for hormones, for your blood sugar, for your insulin, for your, sex hormones. And it does not happen when you're awake. It just happens when you're in sleep. And specifically, if you spend some time in deep sleep, which is REM sleep, right? Deep sleep. I was just talking about sleep last week and already forgot. So deep sleep basically is physiologically restorative sleep. So if you don't get enough physiologically restorative sleep, you cannot just blame your, new medication or other things on the problem. You really want to look at what, wellness habits do you have? What do you do that can be problematic? Okay, so I actually wanted to do just a little bit, one slide on, I call it killing your sex drive one bite at a time. So a lot of people do not realize that, overconsumption of something sweet, especially at night, does actually affects your sex drive, right? So sugar does increase your blood sugar, which is insulin goes up. And when your blood sugar is compromised, your blood vessels compromised. And when your blood vessel compromised, everything in your body is going to be compromised on cardiovascular level, on mental level, and obviously with your sex drive as well. So something we want to look at. And I always say, hey, I'm not saying don't eat that cake, with your, significant other, we want to enjoy all those things, but just kind of keep in mind, is it a, daily habit? Are we doing that at night, every single night, and just kind of feel sluggish, waking up in the morning and just don't feel like we used to feel when we were younger? So if we're doing things differently, we're not going to feel as good. So I always want to mention kind of that overconsumption of any type of processed sweet type of things that can affect your sex drive, and it can affect your energy level in general. Okay, so what can we do about that? Get on your feet, right? So establish some type of movement. I don't even like to call it exercise, but some type of movement in your day, some meaningful movement. I'm not asking anybody to do 60 minutes of walking outside, but 10 minutes, couple times a day, most days of the week, to really get that body moving is going to be extremely beneficial. We talked already about consuming enough micronutrients, right? Really looking at your diet, not like it's good for me or it's bad for me. Super Bowl is coming up this Sunday. Enjoy your food, have some sugar, have a drink if that's appropriate for you. But really having special days in your life to enjoy it, but other days to really eat for how does that make me feel? Can I do a little bit better? So when we talk about alcohol, glass of wine or something like that, perfectly appropriate for most people. Again, if that's appropriate for you. But I always say, hey, maybe be intimate with your spouse or with your partner before you go out and before you eat that, rich dinner or consuming alcohol. So maybe you're going to be not feeling as sexy or as good, after dinner. So it's always perfectly fine, to get close and get intimate before you having a date. So, engaging in safe, regular sexual activities. So actually, the more intimacy you have, the better quality of intimacy you're going to have and better hormonal health you're going to have. So that is a proven scientific fact. We talk about sleep already. I was kind of looking at my notes and I put 7 to 9 hours per night. I think most people don't do 9, so I probably have to change it on some point, but I would say no less than 6, right? So if you're doing 6 hours at night, do 6 hours and 15 minutes and get yourself as close to 7 hours as possible, 7.5 to 8 hours. So, but it's something that is so crucial for us, and we really don't pay attention. And stress and anxiety level, right? So taking things personally, what stresses us out, money, our health, bills, and all those things, just kind of, having that support, talking to somebody, see how you react to stress, and when you feel depressed or stressed or anxious, what habits are you picking up? So how can we help you? Can you have this discussion with your spouse? Can we kind of eliminate that you are going to feel bad about it? So I'm going to finish up, and this is kind of kind of funny slide, I would say, but the question is, would you choose TV over sex? And every time I say that, I always ask myself, well, it depends what's on Netflix, right? If it's a new Netflix show, I might choose a Netflix show over sex. But that is the kind of funny but the same good question to ask, because the average American watches 34 hours of television a week, and I call them kind of empty habits. We have so many empty habits that we don't actually spend time and dedicate our time to meaningful things, as maybe spending time with your partner and have this intimate time, and maybe just laying down together, or if you sleep in different bedrooms, which is perfectly fine. So, but maybe having these date nights and having a little bit more intimacy. And I definitely realized that a lot of some people, they don't have a spouse, so they're alone, and they might, listen to me and say, well, I don't have anybody, I lost my love of my life, and what do I do now? And I think that for some people it may be appropriate to have starting dating, if that's something that you want to do, and have close relationship with your friends. I mean, they don't have to be, like I said in the beginning, there's a big difference between we can have intimacy and fulfill our well-being and all needs that we have through many ways. So it doesn't have to be just sex. So, but again, this topic today, we just, talk about what is safe, what affects our hormones, what can we do, what we're doing that maybe we can do better to actually feel better overall. Okay. And that's about it. And I actually was on time. I always worry that I'm going to be way over or way under. So this is my email. So I work in North Kansas City Hospital. My last name, a lot of people think it doesn't match my first name. It doesn't. That's my married name. But if you have any questions, you can always email to me, and I will, guide you the best my ability. But if we have just maybe a couple minutes, if anybody wants to ask any questions, let's go ahead and ask away.